Hello, friends. I'm Dr. Shunetra. I'm a pediatrician, and today I'm going to discuss about a very common problem in children, that is hypothyroidism. So, a lot of parents come to us regarding this hypothyroidism in children. They have various queries, and today I'm going to discuss a few common queries. And like to thank you, Indian Academy of Pediatrics, for coming up with such wonderful question and answer format with us. I'm sharing these format as these are the most commonly asked question. So first of all, what is thyroid gland and where it is located? It is an endocrine gland and it is located in the lower front of the neck, just below the Adam's apple, on both sides of the trachea. It has two lobes which are joined together by a narrow isthmus, looking like butterfly wings. What does a thyroid gland do? Being an endocrine gland, thyroid hormones releases hormones. Two most important hormones being thyroxine, commonly known as T4, and triiodothyronine, commonly known as T3, which are released in the bloodstream. The secretion of both of these T3 and T4 is regulated by another hormone known as thyroid stimulating hormone, or TSH, which is secreted from another endocrine gland known as pituitary gland located in the brain. The important function of these hormones in children are these are very important for normal body functions. First, causes regulation of temperature, heart rate, and bowel movements. Moreover, they are responsible for normal growth of bones, teeth, and muscle, critical for normal brain development in the womb and in an infant. Pubertal maturation. The lack of these hormones or an excess thus can cause health problems. Now, coming back to our problem, what is hypothyroidism? So, less amount of secretion of these thyroid hormones is known as hypothyroidism. When thyroid gland makes less amount of T3 and T4, there is an upregulation in secretion of TSH from the pituitary gland to signal the thyroid gland to make more of T3 and T4 glands, thus maintaining the balance. When these upregulation and these control mechanism fails, this produces various signs and symptoms, and this is known as hypothyroidism. Thus, hypothyroidism has decreased amount of T3, T4 and increased amount of TSH, except for central hypothyroidism where TSH level can be normal or low. Now, hypothyroidism is mainly of two types. It can be congenital hypothyroidism or acquired hypothyroidism. Congenital hypothyroidism means when the baby is born with hypothyroidism. That is when the thyroid gland does not develop or function normally before birth. Causes can be absent or underdeveloped thyroid gland, commonly known as dysgenesis, or developed in wrong place, or ectopic thyroid gland, one that has developed but cannot make thyroid hormones because of production line problem, commonly known as dyshormonogenesis. Apart from that, any iodine deficiency in mother or drugs used to treat thyroid disorder in mother can cause congenital hypothyroidism in the baby. Central hypothyroidism caused by structural or production line problems in pituitary gland while it was developing. Acquired hypothyroidism, where the thyroid gland does not make enough of thyroid hormones after birth, usually later in childhood or adolescence. Causes can be iodine deficiency or excess, autoimmune disorders, commonly Hashimoto's thyroiditis, in which body's immune system slowly destroys the thyroid gland and decreases production of thyroid hormones. These are the two most important and common problems associated with acquired hypothyroidism. Apart from that, there can be some medications or children with other autoimmune disorder can be associated with autoimmune acquired hypothyroidism like type 1 diabetes mellitus, celiac disease, chromosomal disorders like Down syndrome, Williams syndrome, Turner syndrome, or also some injury to the thyroid gland in the form of infection, radiation to the neck for head and neck cancer can also lead to acquired hypothyroidism. Now, what are the signs and symptoms which appear in a children from which we suspect hypothyroidism in a children? So, for congenital hypothyroidism, the signs and symptoms will be like jaundice, that is yellowish discoloration of the skin and eyes present beyond the first 2 weeks of age, or constipation. Number 3 will be umbilical hernia, that is large belly with protruding navel. Number 4 is excessive sleepiness or sluggishness. Number 5 is hoarse cry. Number 6, delay in achieving age appropriate developmental milestones. Number 7 is low body temperature or hypothermia. Number 8 is large tongue. Number 9, swelling around the eyes. And number 10 is poor muscle tone. Whereas for acquired hypothyroidism, similar features can be slowing of the height gain, delay in tooth development, neck swelling or goiter development, deterioration in school performance, poor memory or concentration, delay in starting of puberty, early or irregular menstrual cycles, feeling cold, tiredness and low energy level, slow pulse rate or bradycardia, dry skin and brittle hair, puffy swollen face, and swelling of the cuff muscles of the leg. Now, how can we confirm, or what are the tests available by which we can know that there is hypothyroidism in children? First of all, to detect congenital hypothyroidism, there is a screening tests available. Congenital hypothyroidism is not a rare problem. It affects around 1 in 2000 babies, and if not detected early, ideally within the first 14 days of life, it can lead to mental subnormality. Most guidelines suggest that screening of every newborn is essential. For screening, a small amount of blood is taken from the baby's umbilical cord at the time of delivery, which is totally painless procedure, or few drops of blood is taken by performing Hill prick test after 48 to 72 hours of birth. This will be tested for thyroid stimulating hormone TSH, and if result comes high, we should do complete thyroid function test includes TSH free T4 or T4 to confirm the diagnosis. Rarely there can be a situation when this test can be negative. Still, a child have the problem of hypothyroidism. In such cases, if the child develops any signs and symptoms suggestive of hypothyroidism, we should repeat this thyroid function test. For acquired hypothyroidism, where the child has already developed features of hypothyroidism, complete thyroid function test is performed along with TSH, which will show high TSH and low T4 values. A very frequent, commonly asked question is that, does my child need any other tests besides the thyroid function tests? How do they help in diagnosis or treatment? Sometimes, in order to know the cause for hypothyroidism, we may need some tests like ultrasound scans of the neck to assess the status of thyroid gland. It can confirm the size, location and absence of the gland. In some case, a radionuclide scan is more helpful. For acquired hypothyroidism, we should do anti-thyroid peroxidase antibody or anti-TPO antibody test or anti-thyroglobulin antibody test to rule out autoimmune or Hashimoto's thyroiditis affecting his or her immune system. How safe are these tests for children? These tests are totally safe when undertaken for a children. Now the most important question is how to treat this child. For congenital hypothyroidism, does my child need treatment for this hypothyroidism? Yes. Since thyroid functions are abnormal, the child should take the medication. If a child is not given this medication, the child may likely to develop mental subnormality. How and when this medication is to be given? Medicine should be given in empty stomach at least half an hour before food. It will be better if given at the same time every day. Crushed tablet is mixed with small amount of breast milk or water and given using a spoon. We should not dilute the tablet in water and keep it for long period of time. It should be made fresh every time before giving the tablet to the child. How long my child should continue with this treatment? If the child have problems like complete absence or agenesis of thyroid gland or abnormally placed thyroid gland with reduction in size, that is ectopic gland, treatment must be continued lifelong. In a small percentage of cases, the gland may be normal with reduced functioning at birth. In such cases, function might improve over some period of time, and in that case, medicine can be reduced or discontinued at around 3 years of age. But then also, after discontinuation, regular follow-up is needed, and again, if signs and symptoms or if biochemical values suggest hypothyroidism, we need to restart the treatment. Treatment for acquired cases. The questions asked are, does my children need treatment for hypothyroidism? Again, yes. Since the child is having reduced functioning of the thyroid gland, treatment should be initiated. If the T4 were normal and TSH is only mildly elevated, it is called subclinical hypothyroidism. Or if both the T4 and TSH levels were normal, we would have waited. But in some such cases, frequent follow-up is essential. How and when this medication is to be given? Again, it should be given in empty stomach at least half an hour before food. How long this should be continued? The disease is a long-lasting one, and hence the drug should be continued for years, sometimes lifelong. Drug dose may need to be altered based on the thyroid functioning tests, which will be measured at regular intervals. Even if we stop the drugs based on the results, monitoring should be performed lifelong, and the drug may be restarted if the results turns out to be abnormal. Then, a very frequently asked question is, what else should I know regarding the treatment? Or, commonly asked is, does this drug produce any adverse effects in this child? Since our child is receiving only a normal replacement, the drug will not produce any side effect. Is there any liquid formulation for this drug? Unfortunately, there is no liquid formulation. The tablet is to be given as prescribed earlier in appropriate dose. What should be done if the child misses the dose? As far as possible, the child should not miss any dose. It is better to maintain a logbook or do a tablet counting of the tablets remaining in the bottle by the weekend. If he or she forgets to take the drug in the morning, then the child can consume it in any other time of the day. But this should not be a regular practice. Can the child take any other medication along with this drug? Better to take this drug alone. Some medication will decrease the absorption of this drug, such as calcium, zinc, and soy preparations, and also iron tablets. So, better to avoid them while taking this drug. If the child vomits, then what should we do? If the child vomits within half an hour of consuming this drug, then this has to be repeated again. Is cabbage and cauliflower not good for this child? Should they be stopped? And is there any other dietary restrictions? No, there is no such restrictions. The child should continue with normal diet. Is there any other treatment besides taking medication that can cure the child? No. Thyroid hormone replacement is the only proven treatment, and fortunately, this can be done by a simple oral formulations. So, better to continue it as advised by your pediatrician from time to time. When do I follow up with doctor after diagnosis? The first follow up after starting the medication should be between 2 to 4 weeks. Parents play an important role in ensuring regular follow up and continuity of medication to prevent any permanent mental or learning disability, which we are stressing upon. How many times do I need to do the blood test is a very common question asked by the parents. Well, common guidelines usually followed is for children less than 3 years, it should be taken every 2 to 3 months. For more than 3 years children, it is to be done at an interval of 3 to 6 months till growth and puberty is complete. After a change in dose, the tests to be performed within 4 to 6 weeks. What will the doctor monitor on these follow-up visits? Usually free T4 and TSH, and it is done before taking the medicine. This is done in order to confirm the adequacy of dose. If too less a dose, the child may have sluggishness, fatigue, constipation, and be less playful. If the dose is too much, the child may be irritable or hyperactive, feel too hot, have trouble sleeping, frequent urination or stooling, decrease weight gain, and increase appetite. So, in order to control these and monitor this, we need to frequently monitor the levels. Apart from that, there can be problem in height and weight, development or school performance or school grades, and pubertal onset and progression depending on the adequacy of the dose. Then, do we need to still give medicine if the tests and my child both look normal? Yes, the aim of our treatment is achieved, but the aims are achieved with medication. The amount of thyroid medicine will increase as the child grows if this is a normal process. A re-evaluation is done at 3 years in congenital hypothyroidism or after completion of growth and puberty in case of acquired hypothyroidism for deciding the continuity of medicine, because sometimes some transient causes of hypothyroidism can occur. So in order to rule out, we may perform this test at particular time in order to decide if we need to continue the medications or not. However, if the causes are permanent, then even with normal result, the child may need to continue the drug with regular follow-up. Can the child take other medication if there is sickness? Yes, the child can take other medication if there is sickness. But important thing is the child need to continue the thyroid medication along with other medications. So, can the child take vaccination while on treatment with hypothyroidism? Yes, the child can take all vaccinations as per the schedule while on treatment. Is a child with hypothyroidism more likely to get other disease later in life? Well, with early and ongoing care, the baby should develop normally, both physically and mentally. However, babies who are not treated at the right time adequately often have permanent health problems such as mental retardation, learning disabilities, and growth delays. Risk of contracting other disease later is similar to normal population. But in cases of hypothyroidism acquired due to some autoimmune disorder, there is likelihood of acquiring other autoimmune disorders later, for which the child will be regularly screened. Well, my other children also have hypothyroidism. Are there any tests I need to do for them? Yes, this is a very important question asked, and the answer is majority of the cases are sporadic, that is, occur in people with no family history. However, a small number of cases are inherited. In few cases of permanent dysharmonogenesis, the risk in second infant is as high as up to 25%. Therefore, the risk of having another child with hypothyroidism is there, but it is low. If the children has acquired hypothyroidism, there is more chance of other children having it because of autoimmune disorder, but this will depend on the cause. Therefore, all siblings of the affected child should have a regular checkup for timely diagnosis of hypothyroidism. Another question is, when a person with hypothyroidism has children, what risk do these children face of having hypothyroidism? Well, for congenital cases, in cases where the mother or father has permanent congenital hypothyroidism, their children being affected is minimal. But for acquired cases, since the disease is most commonly connected to immune disorder, there is a chance that it can run in families. Hence, their children should have a regular checkup for timely diagnosis of hypothyroidism. So thank you for listening to all the question. Please do subscribe to my channel. If you like this video and like the information, please hit the like button and let me know if you want to have more such content and more such information in future. Lastly, I want to mention some do's and some don'ts for congenital hypothyroidism. The do's are all newborns should be screened for thyroid function test at birth or after 48 to 72 hours of life. 2. All children on thyroid hormone replacement medication should take the medicine daily, ideally in empty stomach at a fixed time. Third, regular follow-up of thyroid function test as advised is important after initiating the medication and prevent any permanent mental or learning disability and affected growth. The don'ts are: first, do not give the medicine with any other medicines or food. Second, do not self-titrate the dose of medications. Third, do not stop the medications in case of other illnesses. Thank you very much.